Hello everyone, welcome to my class. Today, we are going to learn the Chapter 1 of the Orthopedics and the Traumatology of TCM, the classification of injury and the etiology. We have learned this is a subject that studies injuries and disease of bones, joints, tendons, and muscles. With the mechanization of industry and agriculture and the application of high-speed transportation, injuries are more common and complex, and people have higher requirements for the rehabilitation. So, doctors engaged in orthopedics and traumatology of TCM are facing increasing more challenges. The first step for us to form a clinical thinking is how to classify disease based on symptoms or signs. There are many the following classification methods according to the nature and characteristics of the injury. First, classification by site. We divided it into trauma and internal injury. Trauma refers to injuries of skin, flesh, tendons, bones, and channels, and it can subdivide into fracture, dislocation, and soft tissue injury according to the specific site of injury. Internal injury refers to internal organ injuries and injury-induced dysfunction of qi and blood, internal organs, and meridians. For example, a weightlifter suddenly experiences pain in the waist during weightlifting, possibly a compressive fracture of the spine. And a person handling the box suddenly experiences acute lumbar sprain, both of which are injuries of skin, flesh, muscles, and bones. Internal injuries refers to internal organ injuries and dysfunction of qi and blood and meridians. But in this semester, we focus on the trauma section. The second, classification by nature. It is divided into acute injury and chronic strain. Acute injury refers to the injury caused by sudden violence. Please let us to see this picture. We see that both golfers and skiers may suddenly experience pain such as low back pain and leg pain due to improper movements during their experience. This is acute injury. Chronic strain refers to a condition caused by long-term cumulative acting of external forces on the human body due to inappropriate work and research or incorrect posture. Let's look at the following two pictures. One is a grass plating worker and the other is a cyclist who experienced low back pain during long-term work. It is due to incorrect posture or inappropriate work and rest. This is a common classification of injuries. Different clinical categories of low back pain should be treated with different methods. The treatment of acute injury should follow some treatment principles of first aid, while the diagnosis and treatment of chronic strain are complete different from those of acute injury. At last, I will introduce them according to different diseases. The third, classification by time. It is divided into new injury and old injury. New injury refers to recent injury, or those immediately treated after onset, within 2 to 3 weeks. Old injury, also known as presented injury, refers to untreated new injury that is unhealed for a long time or recurs at the original injury site at a certain interval due to some inducement after healing. Or recent injuries within 2 to 3 weeks or those immediately treated after onset are new injuries, which are relatively simple to treat. However, old injuries are relatively difficult to treat, so we must understand the onset time. The fourth, classified by damage to the injury site. We divided it into closed injury and open injury depending on whether the skin or mucosa at the injured site is damaged. Closed injury refers to the injury without external wounds caused by blunt violence. Open injury refers to the injury with wounds caused by the damaged skin or mucosa due to sharp instruments, firearms, or blunt violence, where deep tissues communicate with the outside environment. In short, it is a trauma in which blood can flow out or muscle or bone is exposed, such as abrasion, laceration, cut wound, and stab wound. Open injuries are common either at ordinary times or in wartime, as wounds are mostly contaminated. Skin is the outer wall of a person. If the skin is intact, the wound will not be contaminated, preventing pathogens from entering. If the skin is damaged, pathogens can invade from the wound, causing infection. Let's see. As can be seen in the first picture, our children had knee joint bleeding and damaged skin and mucosa after an accident fall, and we call this injury an open injury. And the second picture shows a patient with metacarpal fracture. She had no change in her skin appearance, but the entire palm showed swelling, so we call this a closed injury. This classification is simple. So the fifth, classification by severity. It is divided into minor injury and severe injury. The severity of injury depends on the nature and the intensity of introduced fracture, the length of action, the site of injury, and the area and depth of injury. The severity of injury depends on many factors, which are not described here, and the relationship between minor injury and severe injury will be reflected in each injury described later. The sixth, classification by occupational characteristics. First, let's look at this picture. In the picture, a young man feels neck pain, so what does he do every day? Let's see. Sleeping on a table, easy to lose his temper, blowing cold air, using computers for a long time, and enjoying cold water showers. He often suffers from neck pain and stiff neck. This is an occupational disease of most people working at desks. Therefore, injuries can be divided into lift injuries, industrial injuries, agricultural injuries, traffic, and sport injuries according to the occupational characteristics. Those who often read books or watch TV in bed with excessive neck flexing, and those who work at desks for a long time are prone to cervical spondylosis. While athletes and dancers, acrobats, and martial arts players are prone to various sport injuries. Suggestion that the occurrence of injury is related to occupation and living habits. The seventh, classification by physicochemical properties of inducing factor. Physical injury, chemical injury, and biological injury. Physical injury includes external force, high heat, freezing, current, etc. While the orthopedics and traumatology of TCM focus on the injury caused by external force. The eighth, classification by pre-injury tissue condition. This is the last classification. So let's see this picture. The player suffered from sudden severe pain in the knee joint when playing basketball, which is a traumatic injury of the meniscus, cross-stitch ligament of the knee joint. Looking at this old woman, she suffered from a fracture in the spine, simply by coughing because she is old and has osteoporosis. So, when exposed to a very gentle external force, she is likely to have an injury. Therefore, in clinical syndrome differentiation and treatment, it is necessary to classify the injuries and disease with reference to the above classification methods in order to carry out correct diagnosis and treatment and achieve a better effect. Thank you.